This may look like a scene from a science fiction movie, but it's actually film taken inside one of the 2 orthopaedic operating theatres at North Devon District Hospital. The journal was given permission to film orthopaedic consultant Nicholas Treble perform a knee replacement operation. The patient was 81-year-old Audrey Masterson. Audrey, or Velda as her friends know her, had been suffering from osteoarthritis and needed a total knee replacement.
I used to be so active and used to do such a lot. You know, I couldn't play tennis, I couldn't play badminton, couldn't go walking, I couldn't do anything. So my life really was at a standstill at the time. I wanted to go to Marks and Spencer's. I'd park the car in the car park, and walk as far as Marks. By the time I'd picked up my shopping to come back to the car, it was impossible. The pain was shocking. I went into the hospital the day before the operation, which was a little bit apprehensive because you don't know what's going to happen to you. But everybody was so nice in the ward. The nurses were very nice, very kind, and sort of put you at your ease, really. And then by the time you'd got settled in the night following morning, it was time to go for your op, so you really didn't have a lot of time to worry too much about it.
This patient has osteoarthritis affecting both of her knees. As is commonly the pattern, the wear is more on the inside of the knees than on the outside. The effect of the wear of the bone surfaces here is that the legs become increasingly bowed or bandy. The operation not only resurfaces the joint, but it realigns the leg to the correct alignment. What we do is we replace the damaged bearing surfaces with an implant made of metal and plastic. When we're implanting prosthetic components into a patient, it's absolutely vital that no infection's introduced. We go to great lengths to ensure that total stability is maintained, both in the way we practice, the theatre protocol, and the design of the operating theatres. Having made the bone cuts, the next step is to make sure that the soft tissues are properly balanced, so that the knee functions as a normal hinge. Yes.
Okay. I'm ready for the implant.
The components are then inserted and held in place with a form of acrylic cement. Just coating it with this. It's called cement. It's not actually an adhesive. It just fills in the gaps between the. I mean, there shouldn't be a gap at all, but if there's any slight gap, a bit more cement, please. Thanks. It's very important that the components are inserted in exactly the right position in order that the knee functions properly. And after that the knee is closed up and the patient goes back to the recovery area.
Okay, down. Oh, 49 minutes.
Audrey, hello there. Operation's all finished.
There we are, we've got some sticky stuff.
We're on to your company bed now. 1, 2, 3, 5.
Joint replacements have become one of the success stories of modern medicine, combined with the ever-increasing life expectancy and expectations of the population. The number of joint replacements is steadily rising in this hospital as it is throughout the country. And we expect this trend to continue for many years to come. It may be that in the future medical cure will be found that means that we don't need to perform this type of surgery, but at present that is not on the horizon.
I think the fact that the staff were so kind and so nice that it took away a lot of the apprehension you might feel. I love walking over the cliffs and down cliff paths and country walks, which I hope now I can do, which I couldn't do before because I just couldn't cope with the pain. So hopefully, I mean, getting a bit old to say dancing and what have you, but I wouldn't have any qualms. I wouldn't worry about it because you're taken care of so well that you don't need to worry.